I never thought I wanted to be a nurse until my senior year of college, getting my bachelor's in singing, opera, music.
Wow.
And I worked in ICU for 8 years with stroke patients at the bedside. So I know more people who have had stroke than who have not. And I had to leave the bedside because I got to the point where I felt like everybody had a stroke. There's 800,000 strokes in the United States every year. Mm-hmm. And so the more I hear about how widespread it is and how it's the number one leading cause of disability in the world, I wanted to be able to reach them all, but I'm just one person. And I started having so many people reaching out to me saying, I would love to be on your podcast. I don't just make a podcast. The vision is to make sure we're getting these important health messages out on a platform that people can listen to when they're driving around, and they don't have to necessarily go to a library and a specific location, but make that really important information available. So addressing these things has been so meaningful, and now it's heard in 76 countries. It won first place at the International Stroke Conference. It's a free gift to humanity.
Welcome to the Nurse on Purpose podcast, where we challenge media stereotypes about nursing and spotlight the incredible and diverse roles nurses play in healthcare. I'm your host, Nello. Every week, I'll be joined by a nurse who is reshaping the narrative. From frontline care to leadership, education, innovation, and beyond. Our aim is to show the world that nursing is so much more than what we see on TV. Together, we'll explore how we can collaborate with media and other stakeholders to create authentic and inspiring portrayals of nurses. Let's begin the conversation and ignite change, one episode at a time. Hello, everyone, and welcome again to the Nurse on Purpose podcast. Joining me today is Nurse Rosa Hart. Rosa Hart is the owner of Rosa Hart Media Consulting, LLC. She's a stroke nurse navigator, a speaker, and a podcaster. And guys, when I say she's a podcaster, I'm talking like a serial podcaster. She is both a host and or producer of 4 podcasts, namely Stronger After Stroke podcast, Nurse Rosa's Insights, Aging Like a Pro, and the Lou Review. So Rosa, you are like my big sister. You're like the grandmaster in this podcasting game. It's crazy. You're so welcome to the podcast.
Oh my goodness. Well, I love what you're doing, Nello, and how you're interviewing nurses about, their purpose and how we can, work together to make healthcare better and empower one another. So thank you for using your voice to strengthen the profession.
Thank you so much. I appreciate that. And so I usually kind of go from top down and ask about the whole nursing journey and all of that. But this time, I think I just want to start from where we are. So let's really chat about the serial podcasting lifestyle that you're living. Because first of all, how is it even possible? I know how much it takes just to host one. First, just tell us how you got started as a podcaster and what each one of these podcasts is about.
Well, I will say that when I started podcasting, I definitely did not have the very thorough template that you're using. And I was definitely not as organized from the beginning as you are, okay? You are kind of just pulling things together and figuring out what works. You don't always start with the best plan in mind, right? You got to figure out what works. But you wanted me to start with the first podcast?
Yes.
That is the Lou Review,
okay,
which was not my idea. It was my friend's idea.
Yeah.
It is a podcast about the restaurants and nonprofits in Louisville, Kentucky that make it a unique place. Mm-hmm. And we recorded the first episode of that in July of 2020. There's a new restaurant opening up and we wanted to try it out. He said we can review it too and let people know how it is. And I was like, well, how are we going to do that? You're not really a writer, and he was like, we can make a podcast. And I was like, what's a podcast? So we recorded our first podcast about that experience, and I talked about the safety measures that were in place as far as the tables being spaced out and using disposable plates and silverware and things like that were like COVID precautions at the time, and just letting people know if that would make them feel safe going out to eat, that was being taken into consideration, because we wanted to support the locally owned businesses in this area. We have a wealth of restaurants. Okay, I've been to over 400 restaurants in the last 4 years in the
Wow.
Louisville area that are locally owned and operated. And Chicago better watch out, because we're going to give it a run for its money. The average quality of restaurants in Louisville is so high that as I've been traveling more recently, I'm consistently disappointed in other cities. And I'm like, I'm going back to Louisville, y'all. We may not have any lounges in our airport, but you don't need them. Just come out into the city and you'll get
That's
some really
awesome.
good food.
That's wonderful. So, and then what about the Nurse Rosa's Insights? What's that podcast about?
Nurse Rosa's Insights. Usually I would talk about that after Stronger After Stroke, because it really exists.
Ah, I see.
Because after I made Stronger After Stroke for the Norton Neuroscience Institute for my stroke patients that normally I would be calling and doing follow-up education for, that was really well adopted. And then I started having so many people reaching out to me saying, I would love to be on your podcast. And I was like, I'm sure you would, but you have nothing to do with stroke, so that doesn't make any sense.
Yeah.
But these people are amazing and they have great ideas about how to make healthcare better. And I really wanted to amplify their messages, because I've seen the impact of amplifying the voices of people who otherwise may not have the marketing budget to get their ideas out there, like with these small business owners that I've been giving basically thousands of dollars worth of free marketing for the last 5 years.
Wow.
And so I know that can really make an impact, just getting someone's story out there further than it would reach necessarily on its own. A lot of people who have great ideas may not know how to use social media to share their ideas. And so that's another layer that I add on to. I don't just make a podcast. I post about it on social media, which is how people find out about it. Even if they don't listen to the whole episode, they can get like a hint of the idea.
Yeah.
And that's been really powerful. So I think I just recorded like the 20th episode of Nurse Rosa's Insights, which is on the Health Podcast Network with Stronger After Stroke and Aging Like a Pro.
Awesome. Okay, let's talk about Aging Like a Pro, and then we'll finish off talking about Stronger After Stroke, because that's really where I wanted to center our, focus our attention today. So tell me about Aging Like a Pro, that podcast.
Yeah. So, and actually that kind of goes back to Stronger After Stroke as well, because I got to interview Dr. Tatjana Rundeck from the University of Miami Miller School of Medicine, Department of Neurology. She was speaking at our event for the community, doing some stroke education, and she took the time to sit down with me and talk about brain health and stroke prevention, as well as just how we can have a healthy brain as we age. And because of that interview, she really caught the vision for using podcasts to share health education information. And they were working already on the Aging Like a Pro seminar series in Miami and the surrounding area, educating people on how they can age with the healthiest brain possible.
Awesome.
And so they hired me as a consultant to come to Miami and interview their neurologist researchers and really put that information they had been sharing in a community like lecture presentation format in more of a discussion format, where it's more palatable to listen to if it's a conversation than if someone's lecturing with a slideshow at you, right? It's kind of hard to stay awake for some of those sometimes, even if it's a great presenter. But when there's back and forth, that was really the vision, is to make sure we're getting these important health messages out on a platform that people can listen to when they're driving around, and they don't have to necessarily go to a library and a specific location, but make that really important information available publicly and to the world.
Yeah, that's so important, because sometimes patients leave their providers' offices and they're more confused than when they stepped into it. And that's because the information just sort of blows over their heads because it's not as simplified as a layperson would need it to be to understand and really make use of that information. So I love that on your podcast, you're simplifying the information so that anyone who listens can really have an understanding and not have to be in the healthcare professions to do that. All right, so let's.
I need to circle back to that because what you are talking about is like not necessarily commonly practiced, I feel like, even though it seems like it makes so much sense. But the other person who runs the Aging Like a Pro program that developed it is Susan Fox Rossellini, soon to be Dr. Susan Fox Rossellini. And her grandfather, I think it was William Fox that established 20th Century Fox.
Oh.
Okay. And she wrote his biography, and she was sharing with me that when he was establishing, this cinema legacy, his vision was really actually to use movies to teach. And he had that vision back when there was like black and white movies that we can use this for education. We can use this to standardize education across the country and across the world. And so that if you have really good quality education happening in, say, California, where he was, then you can duplicate that through movies everywhere. And so she's really wanting to carry forward her family legacy, and I'm so honored to be a part of it with Aging Like a Pro.
That is so wonderful. We both know this. Media has such a powerful impact on people's public perceptions and educating the public because we are all engaged in media, whether it was back then or now even more so. What we see can truly form our opinions. And that's why I'm so passionate about making sure that our image in media is protected and is uplifted and elevated to the best possible measures so that whoever's watching can know what nurses truly do. And that's why I also have this platform, because this is a form of media and highlighting the stories of real life nurses. So people can see nurses can be all kinds of things. Very important message that you just shared. All right, so let's now talk about the Stronger After Stroke podcast. Sorry, I had a little brain
fart. Do you want to restate that?
Because you have way too many. I'm trying to keep myself together. Okay, Stronger After Stroke. Let's talk about that because I know that really ties into your journey as a nurse and all of that. So please feel free to talk about all of that if you want to.
I think everyone in my life would tell you I can't shut up about Stronger After Stroke. So I worked in ICU for 8 years with stroke patients at the bedside. And so I know more people who have had stroke than who have not. Right?
Wow.
And I had to leave the bedside because I got to the point where I felt like everybody had a stroke. And it was really hard for me to deal with this anxiety that I kind of developed from that. And so I needed to see success stories. And I was so thankful to get the role of stroke nurse navigator for Norton Healthcare, because then I could do the follow-up calls, and people who get to go home typically are doing a lot better. And so that's really encouraging. But if you've had one stroke, you're at risk of having another one. And so I got to provide education and still do get to provide education about how we can try to prevent another stroke with risk factor modification like blood pressure, cholesterol, diabetes, smoking cessation, sleep apnea interventions like using a CPAP. All of those things are really important for stroke prevention. And then also because my position is under the Norton Neuroscience Institute Resource Center, I get to identify financial and transportation barriers that they are encountering, as well as psychosocial mental health issues they're dealing with, and connect them to those resources in the community that can help them actually participate in things that can help them. And so it's like a very holistic approach.
Yes.
But as I was making those phone calls, I'm one person. And for example, we get 1,800 stroke patients for our system a year alone.
Wow.
There's 800,000 strokes in the United States every year.
Mm-hmm.
And so the more I hear about how widespread it is and how it's the number one leading cause of disability in the world, I wanted to be able to reach them all, but I'm just one person. So my boss actually called me into the office and said, we're talking about creating a podcast for Norton Neuroscience Institute. You already do the Lou review. Would you be interested in making one for your stroke patients?
Wow.
And I was like, of course, yes, please. I would love to do that. And she said, well, take some time and come up with some topics. And 2 hours later, I was back in her office with 2 pages worth of topics and had an interview about them. Because these are things I've been repeating myself about for years.
Yeah, passion and preparation.
Yeah, exactly. I mean, it was off the top of my head.
You're right.
Yeah. Mm-hmm. And obviously there's been tweaking since then. It's
of
been,
course.
intentionality, because they said, well, let's actually scale it to like once a month we'll release a new episode. So we've been trying to make each episode like a gold nugget of information that has actionable information for whoever is listening, wherever they are. If they can't come to the Norton Neuroscience Institute, they can still listen and learn that what they can do at home to rehabilitate, what they can do at home to cope with anxiety. We have a couple episodes on sex after stroke with a certified sex therapist and pelvic floor therapist, talking about how to have those conversations with your partner when things can't be the way they were, but how to learn to connect in a new way. So addressing these things has been so meaningful, and now it's heard in 76 countries.
Oh, wow.
And it won first place at the International Stroke Conference. It's a free gift to humanity. That's why I can't shut up about it.
That's wonderful. So if you were to teach a layperson, since I have the stroke expert with me, and I have listeners who may not know what a stroke is and how to identify it in themselves or their loved ones, if you were to just teach a layperson, right, maybe a patient, the basics about a stroke, what it is, the types, how to identify you're having one, so symptoms, how it is medically diagnosed, how it is treated, any residual effects, and maybe what some preventive measures. Can you just give us like a quick Cliff's Note version for stroke and stroke education?
Sure. There are generally 2-ish types of strokes. There's ischemic and hemorrhagic. Ischemic is when there is a obstruction of some kind, causing a lack of blood flow to the brain, usually an artery that's occluded. Sometimes a vein gets backed up. That's another conversation. And then there's hemorrhagic strokes where there's bleeding in the brain.
Yeah.
And the treatments are very different. And a common cause can be hypertension, because hypertension, especially smoking, can cause hypertension. It can also cause damage to the blood vessels.
Yep.
So a lot of the same causes can result in like either one. But to recognize the signs of a stroke, we use the acronym BFAST, where B is for balance, so a sudden change in balance. E is for eyes, a sudden change in vision. Could be blurred, could be double vision, loss of peripheral vision, and the key is it comes on suddenly. F is for face, where one side will get a facial droop. A is for arms. We'll have people hold out their arms and see if one side is weaker than the other. And a sudden onset of one-sided weakness is a pretty clear sign of a big stroke.
Yeah.
S is for speech. It could be slurred speech. A lot of times people will describe it as they sound drunk, but they are not. I know they're not. Yeah. And then it could be not understanding what's being said to you, or not being able to get out the right words. So all that falls under speech.
Yeah.
And then T is for time or terrible headache. For the hemorrhagic strokes, for particularly one called the subarachnoid hemorrhage, it's telltale sign is a thunderclap headache, where they might even feel like they heard a thunderclap in their brain, and followed by the worst headache of their
Headache
life.
of their lives, yeah.
And then the T would still be for time, where time saved is brain saved to call 911 and get to the hospital as soon as possible. Not recommended to drive yourself. Different hospitals have different levels of stroke care. When you call 911, the EMS team should be trained to recognize whether or not this is a stroke versus something else, because there are things that look like strokes that they may be able to intervene on at home, like if it's a blood sugar drop type situation. But then they also should have access to the information on what stroke centers are available. Not every hospital is a stroke center, which means they may not be equipped to even do a scan to be able to identify if you're having a stroke, let alone give a treatment. And there are some really incredible treatments for stroke, including Alteplase, or now Tenecteplase, called TPA or TNK. Which is an IV medication that can be given to break up the clots causing an ischemic stroke. And a lot of people can also be eligible for an endovascular procedure called the mechanical thrombectomy, where an endovascular neurosurgeon can go into their arteries and pull the clot out of their brain. But then in the case of the hemorrhagic stroke, they may need more even invasive brain surgery, which you would need to be at more comprehensive stroke center for, that would have those neurosurgeons on staff. So that is why EMS matters, because they are that first line of identifying where to take people. And don't ask for permission. If you think someone is having signs of a stroke, call 911 and don't ask the person who is having stroke symptoms, because if that is the case, like, their brain is literally under attack, and they're not the one that needs to make that decision. At least let EMS come and assess them and talk to them.
Awesome. Preventive measures.
Yes. So as I mentioned, number one thing we can do to prevent stroke is blood pressure control. However, nothing in our body is an island unto itself. And I've recently learned from an endocrinologist that I was interviewing for Stronger After Stroke, one of the first signs of diabetes can be increased blood pressure. So, I mean, it really is all connected. So we want to make sure our blood sugar is not being elevated on a daily basis, and check for pre-diabetes even. We want to look at cholesterol levels, and HDL is the good cholesterol. LDL is what we call bad cholesterol. The HDL is good cholesterol because it carries the bad cholesterol out of your body. And really the main thing you can do to raise the good cholesterol is be physically active. So when people say to increase your activity to prevent stroke, I mean, there's so many ways that it does that, but it does directly act on your cholesterol itself. Blood pressure management also ties into, as I said before, using tobacco and nicotine products, but also sleep apnea can result in uncontrollable hypertension. So there's a lot of people who I'll talk to who will be on 3 or more medications for blood pressure, trying to get it within the safe zone. We want it less than 130/80 for stroke prevention. And they may be struggling to get it there on multiple medications. And sometimes that is something I learned from a pulmonologist, that can be an indicator of sleep apnea. Maybe they don't even snore, but because they're not getting enough oxygen when they're asleep, that oxygen's not being distributed all over their body, and their body's trying to compensate during their waking hours by increasing the blood pressure to get that oxygen all over their body. And so if someone recommends you get a sleep study to see if you have sleep apnea, get it, because it doesn't seem like it would be related, but sleep apnea can also throw your heart out of its normal rhythm into what's called atrial fibrillation, which is an irregular beating of the heart. And when it's not beating effectively and clearing blood out of the heart chambers, clots can form there that can then travel to your brain and be a stroke. So a holistic approach, seeing the person as a whole person and not individual systems, is
Yeah.
really important because, like I said, our cardiovascular system, our neurological system, everything is interwoven.
Oh, wow. Thank you for that robust explanation.
I
Very
hope that
helpful.
wasn't too much.
No, it wasn't. Not at all. This is the kind of information that the public needs and can benefit
Yeah.
from. With the Stronger After Stroke podcast, I know that you address a lot of questions. You bring guests on there, and they talk about sort of the after effects of a stroke and all kinds of other kind of surrounding topics. Is there something in particular that you feel like you've addressed that has made a difference to a patient?
Oh, definitely. And one of the most common conversations I have with people is about the anxiety that they're dealing with after stroke. I would say fatigue and anxiety are the most common
Mm-hmm.
symptoms people experience after stroke, even if they don't have the deficits that they came into the hospital with. Maybe their body's working and they look normal, but they do not feel the same. And one conversation that I had with a lady in the last few weeks really brought into focus the impact that the coping with anxiety episode can have. So I was speaking with her and we were talking about, her medications and her follow-up appointments and everything. And she was like, but I feel like I'm losing my mind. And so I asked, why do you feel that way? And she said, well, I'm just scared to go to sleep. And my husband is so frustrated with me. And he's telling me, just get over it. Everything's fine. And I want to, but I don't know how.
Mm,
And so I feel like a crazy person in my own body
mm.
because everything is okay, but I get like panic attacks and feeling like
Oh,
it's going to happen again, and then
again,
maybe
yeah.
not be able to get my function back, or maybe I won't wake up again if I go to sleep.
Oh, no.
And that itself is very common to hear from anyone who's had a stroke. However, that interpersonal relationship element of her husband not understanding how she was feeling
Mm,
led me to share the coping with anxiety and depression episode with her. And so I said, try to sit down and listen to this with your husband, because they talk about strategies to kind of de-escalate that anxiety.
yeah,
But also, this therapist explains why this is a normal way to feel after a stroke. It
wow.
means you understand what happened to you. This
Mm,
was a medical emergency. It was scary.
yeah,
And so to just kind of validate that, but
mm,
also give them practical interventions of how to talk through it to get calm back down.
mm,
That was a Friday.
yeah.
She called me back on either Monday or Tuesday, and she
Mm,
said, I have to let you know, it's like I am living in a new house. It's like I
wow.
have a new husband.
Oh,
It's
wow.
like I'm not losing my mind anymore, because he understands that the
Mm,
way I feel is okay.
it's
And
okay.
also, when I get scared, he knows what to
Knows
say to
what
help me calm down. And girl, if that was the only episode
Oh,
and that
my
was the only person that helped,
listen.
the level of impact that had on just her life was so worth it.
Wow. And the fact that she came back to tell you means that it really, it really made a
Right?
difference. You were out here
Yeah.
changing lives.
It's like so many of these episodes, it's like I never know what happens with them, right? If people don't leave a comment or
Yeah,
send me an email, then I don't really know. I
yeah,
hope that it
yeah,
helps.
yeah,
If people in 76 countries are listening, I hope it's helping. But
yeah,
uh, to know conclusively that it made a difference,
yeah.
I'm definitely going to hold on to that one comment.
That's wonderful. We are going to sort of kind of wrap up the talking about the podcast, but I want to ask one more question.
Mhm.
As the host of the Stronger After Stroke podcast, by the way, I think that the name of the podcast really inspires hope.
Mhm.
So what would you say to someone who has suffered a stroke, feeling hopeless or defeated in their own skin, just maybe because their body's not doing what it used to, or like you said, this lady who went through this anxiety, feeling scared, wondering if this was going to occur again. just somebody who has gone through a major change, life change, just momentarily, what would you say to such a person?
For anyone who has already had a stroke, I would definitely want to encourage them that wherever they're at in their recovery, sometimes recovery happens fast, but most of the time it's a longer process that requires, dedicated like physical, occupational, and speech therapy, or talking through it with a counselor. Like, stress is an independent risk factor for stroke. And so sometimes we just have to look at our lives and see, how do we build a life that is conducive to health,
Yeah.
but then also be patient with yourself. Like, if your arm isn't working and you're working with PT and you're working with OT and you're not seeing a change and it's been a year, there's still hope,
Yeah.
because neuroplasticity doesn't stop.
Yeah.
It does need direction, and there are people who can help you be as, strategic as possible to
Yeah.
implement strategies that work, but you have to be patient and not give up. One thing I really appreciated learning from a neurologist I used to work with is, we would tell a patient, raise your arms up so we could see, if one side is weaker and that
Yeah.
arm doesn't work.
Yeah.
But you have to look at it and you have to tell it to try every time. Don't look at it and say, oh, it doesn't work anymore. You have to continue to try, and then
Wow.
eventually, it might take years,
Wow.
but it is possible
Wow.
with that direct intention, not magical thing, but
Yeah.
it's just a matter of getting the brain signals to the neurons that remain to make those new connections to
Wow.
bring back abilities.
Yeah. It's the power of positive thinking and also just the resilience not to give up on yourself or on your
Yeah.
body. And your brain is speaking to your arm, which seems silly, but really, like you said before, the entire body is connected, right?
Mm-hmm.
And I think we have the power to really force ourselves to overcome or kind of slink back into defeat. But yeah, that's a really good key. I wouldn't have thought about that.
Yeah.
So thank you for sharing that.
Yeah.
And I hope it gives somebody out there hope that there is hope to be stronger after you've gone through a stroke, because it feels like your life changed in a matter of moments. But there is hope for you, with the right therapy, with the right treatment. There is hope to regain function and to live a healthy, normal life. Okay, so let's talk about your media consulting company. Tell me how that started and what all you do with it.
Yeah, so I guess it started, from the Lou Review, just organically working with local businesses and supporting them with learning marketing, because that's not something I learned in a nursing school at all. But learning through using social media, like what works and what helps reach people, because word of mouth advertising is really powerful. So that really did start with the Lou Review and providing basically free media consulting to the local businesses. Now I'm converting that into a nonprofit because I want to continue providing that value, but I don't necessarily want to charge these small businesses and nonprofits that I've been basically donating time to. I just wanted to grow that. But the media consulting as a side business that I've been doing really grew out of other people asking me for help to make their podcasts. Obviously, I have an official contract with the University of Miami for that. Like, I have a liability insurance policy for that, but on a smaller scale, like helping other nurses start their own podcast or teaching other people how to use social media for their businesses. So I do little small jobs as well, or creating content for them to use on social media. So all of it fits under all of the for-profit elements fit under the umbrella of Rosa Hart Media Consulting. And then I have now the Lou Review as the nonprofit element.
Awesome. Thank you so much for sharing that. And then I know we started from all the podcasts that you do. Now I want to go back to sort of the top, and just in like 3 minutes, if you can share what drew you to the nursing profession, and then we'll kind of start to wrap up.
Okay, so I never thought I wanted to be a nurse until my senior year of college, getting my bachelor's in singing, opera, music.
Wow.
And I'd been married for a couple of years. I was pregnant, and I took anatomy and physiology for fun because
What?
because I didn't take it in high
Ooh.
school, and I
Uh,
wanted to understand my body and my baby's body
yeah.
to be a good mom.
Yeah.
And then I was getting better grades than the nursing students who were in it, and I was not seeing a lot of financial potential for being a musician. I was kind of afraid of being a starving artist in that
Oh,
respect.
boy. You
So
had an anger
I was like,
too.
well, if nursing has job security.
Yeah.
And then that's kind of what took me. It was from a caregiving motivation to
Hmm.
get into anatomy and physiology. And then it was like, oh, I have an affinity for this, right?
Yeah.
And then this can also be a good career path
Yeah.
to financially support my family. That's how I got into nursing.
Awesome. Wonderful. And I know you worked with several units and then eventually
Mhm.
gravitated to stroke management.
Yeah, so I started as an aide in the ICU, and
Okay.
I was floating between units. So I did like start on a stroke unit from the beginning, but in addition to cardiac, med surg, and oncology. And
Oh, wow.
so just really settled on the neuro units.
Very wonderful.
Mhm.
Okay, so I think that kind of wraps up talking about your journey, passion, your purpose. We're going to transition and talk about the media portrayals of nursing now with the last couple of minutes that we have here. Do you watch any shows, and what is your take on portrayals of nursing?
Yes, I watch shows.
You kind of look like when you said opera, I was like, I can totally see it. Like I can see you as an opera singer just now.
Oh,
And you
I
have the
don't even
voice.
have a Viking helmet.
You have
Really?
the voice, you have the glow.
Okay, I
Yeah,
accept. Thank
that's
you.
awesome. Okay, so tell me about your thoughts.
Before nursing school, and when I was like in college, I watched a lot of House and Grey's Anatomy and stuff like that because that's what was on. And the
Hmm.
portrayal of nurses was not good. So it didn't really make me want to be a nurse. Honestly, I wanted to be a PA. And so I actually went and interviewed at the University of Kentucky for their physician assistant program. But as a new mom, I didn't go through with that. And I think some of that was probably influenced by the TV shows I was watching because Grey's Anatomy, nurses are for sleeping with in the break room. And then in House didn't trust his doctors that were like doing their fellowship or whatever with him. Um, they had to do everything for the patients because he said nurses are barely worth like changing the bedpans. Like that was verbalized,
Yeah, yeah,
okay,
yeah,
and
yeah. I
that is
remember that
not
episode.
helpful.
Yeah,
I tried watching Nurse Jackie, and that was not encouraging
no,
because while she might have known what was going on clinically, she was unethical.
yeah.
And nursing is the number one most trusted profession in health, like, period.
Hmm.
And that's because ethically we have a high standard.
Hmm.
And I'm actually now the chair of the Ethics and Human Rights Committee for the Kentucky Nurses Association because I feel like that is so important. But yeah, that's not necessarily something that was being portrayed in TV shows. I did love the original like ER
Hmm.
show because I felt like Nurse Hathaway was a really good example of competence.
Yeah.
The physicians trusted her, the patients trusted her. I felt like that was a really good portrayal. And then
Hmm.
our friend Nurse Alice Benjamin got to be
Yes.
instrumental in creating
Resident.
Nurse Nicole and the
Hmm.
resident.
Hmm.
And unfortunately, that good representation of a nurse practitioner is not necessarily trickled down, I guess, to the other nurses because she was
Hmm.
doing everything.
Hmm.
So
Hmm.
still kind of saw that like the
Yeah,
provider's doing everything and
yeah,
not the nurses.
yeah,
I did start watching The Pit,
yeah.
which has what's his name, John Carter from ER.
Hmm.
And I appreciate the competence shown by the nurses in that they verbalize trusting them. One of the nurses I work with currently, he pointed out to me, he was like, I didn't like that they were bullying the residents and stuff. He was like, it's really important for nurses and providers to have a respectful working relationship. And
Absolutely.
he was like, even if that is real, that's not what we should aim for. We should
Yeah.
be aiming for collegiality and supporting each other. And so he really wanted to emphasize more positive portrayals of how it should be
Yeah.
in media. Like, just like that physician was advocating for not boarding patients in the ER, but
Yeah.
letting them like go up to the floor so they
Yeah.
could deal with the emergent things. Using media opportunities to show how it should be
Hmm.
is also important.
Yeah, wonderful. Wow, thank you so much for that. I think you have really captured the full scope and the full picture of what I want to promote by kind of using all of these different shows. And I have also recently started, I love The Resident, but again, like you said, it's like one nurse in the entire hospital and she's doing
Who's a nurse
who's a nurse
practitioner, an
practitioner,
advanced
an
practice?
advanced practice nurse. So what about the RNs, you know?
Did they not
So
get to do anything?
that's right. And then also The Pit. I have been watching that.
Oh, I do
Um,
like it.
okay, I have thoughts about The Pit, but I'm not going to go further into them. Let's just.
Are we going to have to take that offline? Because I want to hear your thoughts.
I've kind of talked about it on other episodes, but I
Oh,
also don't
okay.
want to. I love your take though, and I don't want to extend this far more than I know
Okay.
is necessary.
Well,
Um,
one day people are going to want these 3-hour episodes of Nurse Nello's podcast.
ah,
So,
from your lips to God's ears. Thank you. Okay, so let's play our game because you
okay.
know we're coming for that. So I'm gonna be shaking this jar around, picking a category, and then Nurse Rosa, you are gonna turn into the writer of your own show that features a nurse or a nurse lead based on the category that I pick out of the jar. Okay, you ready?
Okay. Okay.
Okay. I looked there, so I'm not supposed to look. Do it again. I'm gonna do it again. Okay, what do I have? I have a romance category. Okay,
Yeah.
awesome.
I mean, there's a reason
You
Grey's
can make it
Anatomy
a
had.
romantic musical since you almost went into
Ooh.
a romantic
Hey, medical
sound
shows
music.
can. Sometimes medical shows can pull that off. I didn't even bring up Scrubs, y'all.
Oh yeah,
Scrubs. They had a. They had the best musical
hilarious.
episode
Yeah,
ever. But anyway, a romance, like a Hallmark movie,
sure, of course.
musical Hallmark
You
romance.
make it musical if you want. It didn't say
Okay.
that, but you can
Oh,
you can add that on. I don't mind.
yeah. Let's see. So if I was going to write a show that would showcase like the competence of RNs, not just advanced practice nurses,
Absolutely.
since they have great representation now. How about stroke nurse
Hmm.
in the ER who gets patients from also a very highly competent paramedic?
Hmm.
And maybe there's a spark there because they're like, oh, I hope you save me one day. I don't know. But I mean, honestly, that kind of sounds like my boss, Jessica Sumner. She's an ER nurse and she married
Oh
an
wow.
EMT or paramedic. And,
Uh-oh.
because
What about this?
they do work closely
Right.
together
Yeah.
and they see each other a lot with when you're bringing in patients with a heart attack or a stroke or something like that. And it really does show you how people respond to a crisis situation.
Yeah.
And so I think a show about that would be, I'd watch it.
Yeah. But
Romance between the ER nurse and she's like, who's bringing this patient in today? Is it that hot paramedic?
oh gosh,
But then,
we
but
objectifying them now.
I mean, if it's ugly, they won't watch it.
Oh my
Just
goodness,
saying.
you're
If you're
so
gonna write a show, you got to write a show that people are gonna
people want
watch,
to
right?
watch. I got it.
Yeah. So just
Awesome.
gotta serve the audience. Yeah.
Awesome. Thank you so much. And you know how Hallmark movies always have like the big city, girl coming into town or whatever.
Which would be perfect because we need more education around the importance of competent stroke care in rural areas. So
Yeah.
we need a big city ER nurse goes out there and works with.
I just love how
paramedics.
passionate you are about stroke management and stroke education in particular. That's wonderful.
I have a different kind of one-track mind, huh?
No, this is a great one-track mind because you're doing a great thing for the community. I've seen you on, giving presentations at conferences. And I just think it's amazing that you're sharing the knowledge that you have, and you're doing it from a place of genuine passion. You truly want to help people and see their lives improved after a stroke. So thank you so much for being here. Can you please tell people where they can find you and connect with you?
Certainly. You can find me on social media at Nurse Rosa Speaks, or you can even contact me through nurserosaspeaks.com.
Love it. You're a little bit of a comedian, I feel like.
Well, thank you.
We connected on LinkedIn, so she's also on LinkedIn, Rosa Hart on LinkedIn, and all of these information will be on the show notes. Thank you so much, Rosa, for being here. It's been a pleasure talking to you. You are so skilled and so knowledgeable. And you just have a natural ability to interact with people and make them feel comfortable. So thank you for doing that. Guys, thanks for stopping by on the podcast. It's been such a wonderful time talking with Rosa. I hope you guys have gained some valuable insight into the world of nursing and about stroke management. And we will see you on the next one. Bye-bye. Thanks for hanging with me till the end. I hope you gained some valuable insight into the world of nursing. If today's episode inspired you, please like, subscribe, and share with someone who needs to hear about the amazing work nurses are doing. Let's keep breaking stereotypes and reshaping the narrative together. I'll see you next time.